Thank you all for joining us. The White House Coronavirus Task Force met today, but it is a particular honor to be here at the headquarters of the United States Public Health Service to make an important announcement on the establishment of the Ready Reserve Corps, and also on behalf of the President and behalf of our entire team to express our gratitude to the women and men who wear the blue uniforms across the country and have served our nation with such distinction and compassion over the past 4 months. I'm here with several members of our team who you will hear from in the course of this briefing. As we gather here today, more than 2.6 million coronavirus cases in the United States. Sadly, we've lost more than 129,000 Americans. The data report that we received today from Dr. Deborah Birx, who is, as we speak, in Arizona, briefing with Governor Ducey and their team, is that at this moment we have 12 states with rising cases and percent positive cases, a combination of both rising cases and rising percent positive. Beyond that, there are another 28 states that either have rising cases or rising positives, but do not have a combination of those two things. We also continue to see that roughly 50% of all the new cases are taking place in 4 states. And so, as you would anticipate, we are working with governors and state health officials in all of the states that are impacted, but we're particularly focusing on the 4 states that are generating the majority of the cases, which of course are California, Arizona, Texas, and Florida. I'm pleased to say that while there are 29 states that don't have a combination of rising positivity and rising cases, we also have an additional 10 states that are either entirely stable or have numbers that are so low that they're de minimis. So our focus, particularly at the task force today, was on the 12 states that have the combination. Beyond that, while one life lost is too many, and we mourn the loss of every American and grieve with every family that lost a loved one, because of the dedication of our healthcare workers, because of our response and the response of the American people, we are grateful that today fatalities are at the lowest level since the end of March. We continue to be vigilant as we see rising cases. We understand that could change, but again, to see the precipitous decline in fatalities is a tribute to the healthcare workers in this country and to the cooperation and the compassion of the American people. Our message to every American in the states that are most affected by rising cases and rising positivity rates is we are with you. We are working with the governors in your state to ensure that they have the resources and the support to meet this moment and provide the level of health care that any one of us would expect for a member of our family. But to all of the American people, I say on behalf of the President of the United States and the White House Coronavirus Task Force that because of all that we've done over the last 4 months, we're ready. We're in a much better place than we were 4 months ago or even 2 months ago. Part of our briefing today will focus on the progress that we have made and our ability to respond to the outbreaks that we're seeing occurring in states, particularly across the South. I've been traveling across the country. I was actually in Texas over this past weekend, received a full briefing from Governor Abbott about their response, and I will be traveling to Arizona tomorrow, meeting with Governor Ducey, and I'll be able to confirm to him that we were informed today that a team deployed by FEMA of 62 disaster medical assistance personnel are on the ground in Arizona. We're also currently processing a request from Texas, and we're in consultation with other states. As you will hear in a moment, with regard to testing, with regard to personal protective equipment, with regard to ventilators, with regard to therapeutic medicines. We are in a strong position all across the affected areas of the country to meet this moment. But in consultation with the states, we're going to make sure that they have the reinforcements in healthcare workers. And I'm pleased to confirm today that 62 DMAT, or Disaster Medical Assistant Team members, have arrived in Arizona. I'll also be traveling later this week to the state of Florida, where Dr. Birx and I will also receive a briefing along with Secretary Azar about that state's response. At the present moment, all 50 states in the country are reopening and have done so in one degree or another since the beginning of May, when we issued our guidelines to open up America again. At this moment in time, because of the rising cases, at least 4 states have taken action to close down bars, limit capacity in restaurants, and another 10 states have slowed down or postponed certain reopening efforts. And let me make it very clear that we fully support the new guidance that's been issued by the governors in these states. We truly do believe that these prudent measures and additional guidance and steps will make it possible for us to continue to move our nation forward, to continue to reopen in a safe and responsible way while putting the health of our citizens first. I thought Dr. Fauci put it well in a recent task force meeting when he said, and I think also testified today, that we should not look at public safety measures as an impediment to opening up America, that rather we should look at them as the vehicle to opening up. As we see rising cases, and particularly those 12 states where we have a combination of rising cases and positivity, the American people deserve to know that our best health experts say it's not an either-or. It's not whether we continue to open up or whether we move in an opposite direction, but rather it's whether we take these prudent measures that will slow the spread and put the health of our citizens first. Our governors in the affected areas and their public health officials are taking strong action to keep their states open while slowing the spread and putting the health of their citizens first, and they have our full support. Let me say again, as I said at the outset, the American people deserve to know that we're in a much better place today. Thanks to the whole of government approach, the whole of America approach that President Trump initiated at the very outset of the coronavirus pandemic. In working in cooperation with agencies across the federal government, working with the private sector across this country, we literally have scaled now 33 million tests have been performed across the United States. And as Admiral Brett Giroir will detail momentarily, we're testing between 500 and 600,000 Americans every single day, with the capacity to significantly increase that through the innovation of what is known as pooling. And when it comes to medical supplies, FEMA has facilitated the delivery of literally billions of gloves and gowns and masks. And as Admiral Polovchek will detail in just a few moments, we are in continuous contact with not just states, but with hospitals in states across the country. And we continue to receive very strong support reports about the support they've received and the supplies that are available to meet this moment. Also, we're in a much better place because of the availability of what's known as therapeutics or medicines to treat people that have contracted the coronavirus and are experiencing severe symptoms. Dr. Steve Hahn of the FDA is here, and he will speak about the progress that we are making, whether it be the availability of remdesivir, which we're distributing another tranche this week, the use of blood plasma, steroid treatments, and also we continue to hear very hopeful signs about the continuing progress toward developing a vaccine for the American people. And so with that, I'm going to yield to the team here to give you updates. I'm going to begin with Secretary Azar, who will update us on our national response, including important work the CDC did today with regard to opening up our schools again. And then Admiral Giroir will update us on testing, Admiral Polovchek on supplies. Dr. Hahn on medicines. And then finally, we'll hear from Dr. Jerome Adams, the Surgeon General of the United States, who will give counsel to every American in the states that are impacted and all across the country about best practices. So to every American in states that are seeing rising cases and rising trends in positivity, we want to assure you we're with you. And we're deploying, at the President's direction, the full resources of the federal government to meet this moment, and working in strong partnership with your state and local officials. And to every American, we want to assure you that we're ready, more ready than ever before, to meet this coronavirus pandemic because of the resources that our President, that agencies at the federal government, the steps and deployed and efforts at state government, and mostly because of what the American people have done and demonstrated that they have the ability to do. I mean, the truth is, while we've made great progress on making availability testing and supplies and medicines, we all need to do our part. We know how to slow the spread. The common sense measures that we outlined in our phased approach to open up America again, the guidelines that apply to all of the phases ought to be embraced by every American. Wash your hands, practice good hygiene, and wear a mask. Wear a mask whenever your state and local authorities say it's appropriate. So it's always a good idea to wear a mask when social distancing is not possible. We're all in this together, and we have every confidence that as we met the moment before when we saw this pandemic first strike in the Northwest and then strike so hard around the greater New York City area, then New Orleans, then Michigan, that with a whole of government approach, a whole of America approach, cooperation of the American people, we'll do what we did earlier on in this pandemic. We'll slow the spread and we'll save lives.